in India today, and what are organizations like SEWA doing about it? I would expect that a response to a question like this would take several hours, but we have 4 minutes.
Namaste. I will draw from the experience of SEWA's Swachh Akash, as we call, which is the Building Cleaner Skies campaign that was launched on SEWA's 50th year in 2022 and is now run by and for SEWA's 3.2 million members across almost 20 states in India. And I would like to offer several points, but the first and the foremost is that what is really important is that when women are leaders in the process of climate and well-being of women and mitigation, I think when we talk about responses to extreme heat by the citizens of India, both urban and rural, all who are working women in the informal sector of India play a major role when we talk about heat or cooling. I can give some very concrete examples, and since I have only 4 minutes to give these examples, I think what I would really like to emphasize here is how heat snatches away the dignity and the self-respect of the poor women workers in the informal sector. Because we heard about science all through, but science also has to look at this aspect as well. And when there are extreme heat events or shocks, women and their families are not able to go to work, even if they have support income sources such as cattle or livestock, that also the income drains out. And women are compelled to go back to the traditional sources of money lenders. And these money lenders start lending at not only exploitative rates of interest, but they also ask for sexual favors. And these things never come out when we talk about heat stress. And this, when you have a woman who has to, go through these things in front of her children, in front of her husband, it's an assassination of a person. It's an assassination of a woman worker. And that is where I think two things which have really helped address this, and that's the parametric heat insurance product that we've been now, this is the 3rd year, where we have 500,000 women who will be enrolling. And not just that this is subsidized entirely or somebody's paying for it, the women are paying for it, almost 50% of the premium. And I'm very grateful to the Climate Resilience for all, the CRA, the Ashram, the Rockefeller, everybody. But I also want to say that, what has really helped us in fine-tuning the heat insurance product is the sensor study that we are also doing together with the, I may be pronouncing the name wrongly, but the Lakshmi Mittal family, South Asia Institute, but in short, Sachin Bhai and his team. And I think what helps us is that how do you really fine-tune the parametric heat insurance product? And when do you set your triggers? What kind of wraparound services are needed? And how do you then work on accelerating the adaptation efforts by the women? I would also like to talk about the green villages that we are doing in partnership with the National Rural Defense Council here as well, and how that helps the efforts in cooling. How can the families move to greener homes and to greener indoor cooking methods as well, and how does that lead to lessening the heat inside the homes? And we apply the same to the cattle sheds as well, that how do you make the cattle sheds also cleaner and greener? 4 minutes are over and I would end here abruptly, but whoever is interested, I would be happy to share more in detail. Thank you.
Finished a few seconds before time, which will return to you in round 2. Dr. Vidya Venugopal is next. She's an occupational hygienist and climate change scientist specializing in the intersection of heat, workload, and worker health. As the country director of the NIHR SRIHER in Public Health, we love acronyms, Global Healthcare Research Center, she leads research focused on improving health outcomes for marginalized communities. With a background in environmental chemistry and global research experience, she's been a strong advocate for the occupational health of female workers in developing nations. Dr. Venugopal, your research has for long shed light on the impact of heat on the lived experiences of communities at home and work. How would you take the many challenges that individuals face that Rima Ben outlined to shape future policy? What solutions are begging to be tested? What solutions are begging to be scaled?
Thanks, Sachit, for this opportunity, and thanks, Rima Ben, for all these nice points you gave. Having worked in the space of individual exposure, heat exposure, and health outcomes, I will come from that angle. There are a few things that can be done when it comes to exposure reduction. You reduce the exposure, your outcomes are going to be much better. So when you're speaking about exposure, who needs to be given more importance, or for whom do we have to make sure that exposures are reduced? So Sachit was telling, I was very keen about marginalized communities, which is in a way true, but I am also very interested in vulnerable communities, which includes workers, migrant workers, informal laborers. I come mostly from an occupational background because their heat exposures are the highest when it compares to all the others. Of course, there are elderly workers and elderly people with comorbidities who might have higher exposures and even less exposures but bad outcomes. But those workers who form the foundation of the country's economy are the exposed the most. So when we're speaking about this, what are we going to do about it, and how do we categorize them? Who needs more care? The heat vulnerability index, just for communities and workers, is something that one has to be looking at. When you speak about heat vulnerability index, it's just not one number about the temperature that the person is exposed to, but about what space that person is in. Is that individual exposed to lack of toilets at workplace? When Rima Ben was speaking about sexual favors and other things, I was internally thinking that woman loses her dignity in a workspace where there is no toilets for her. So she either drinks less and eats less so that she can wait till she goes home. So that's something that we see in our research every day when I work with workers. So that's one thing. Another thing is, many of these migrant people, when they go back to their temporary sheds, which corrugated steel or something with absolutely no cooling facilities, how do we even consider them? So that heat vulnerability index might help us categorize and prioritize resources, that whatever resources is available, either by the company, either by CSR or by the government of India, how can we try and categorize these resources so that these people who need the most are given something? And the third thing that I would try to say is, we do have adaptation measures in place. India has adaptation measures. Heat action plans are there. How do we actually contextualize it for the setting? For example, Rajasthan Heat Action Plan is for rural settings. It's a really good example. Ahmedabad Heat Action Plan for urban settings, workers is really good. We can learn lessons, to take lessons from that, and then kind of roll it out to other. And whatever challenges we have had, whatever that can be used as opportunities in other regions. So reinventing the wheel for every single city, state, and rural area is like wasting our time. Another important thing is, how do you even prepare these people? What did we do during COVID to conquer COVID? Risk communication. Risk communication is one area that we think we should be focusing on. When we say heat warnings or heat alerts, when do we send it? Do we send it on the morning when the heat wave is going to happen so that the agriculturists can stop going to work? Or do we prepare them a few days earlier? So all these things are like something that can try and reduce exposures. And advocacy, telling only about problems. Communication should be also giving some solutions. can we do the do's and don'ts? Like how can you protect yourself? And Dr. Tarun Khanna and others very clearly said about the traditional practices that have been used through all the ages before, but now all of this is forgotten, and that now we are in a new space and world where heat is actually directly hitting us. So I will stop here and then maybe let others take questions. Thank you.
Public health professionals love statistics. Statistically, both women